Good morning. I'm Jesse Ammett, your host of Valley News Now, and we have a really exciting new treatment option today that we're talking with Dr. Verstemming and Katie Jackson about. And approximately 41,000 adults currently are affected in the U.S., and another 200,000 people are at risk. The impact of Huntington's disease cannot be underestimated. Approximately 90% of people with Huntington's experience chorea, which is an involuntary movement disorder that impacts all areas of life. And individuals with Huntington's chorea and their caregivers consistently display remarkable strength and resilience in the face of such trying circumstances. And so joining us to shed light on this disease and a new treatment for HD chorea symptoms is Dr. Erin Verstemming, and an expert in the field, along with Katie Jackson, who advocates for those with Huntington's. Welcome again, ladies. Thank you so much for being with me today.
Thank you so much for having us.
Yes. Okay, so Dr. Verstemming, can you tell us, first of all, what is Huntington's chorea?
Yes, absolutely. So Huntington's disease is a devastating inherited neurologic disease that causes breakdown of nerve cells in the brain, leading to cognitive, motor, and psychiatric symptoms. The most common motor symptom is chorea, and chorea is described as an involuntary, excessive movement that makes everyday tasks almost impossible for our patients experiencing chorea.
Okay, right now, are there any treatment options available for people with Huntington's chorea?
Yes, thank you for asking. While we don't yet have a curative therapy, we do have effective medications to treat most of the symptoms in HD. And in fact, we have 3 FDA-approved medications to treat Huntington's-related chorea. We are celebrating the fact that there was recently, actually on August 18th, the third VMAT2 inhibitor approved. The name of this VMAT2 inhibitor is Ingrezza or valbenazine.
Wow. Okay, so can you tell us a little bit more about this new treatment that's available?
Absolutely. So valbenazine is a VMAT2 inhibitor, similar to the other 2 VMAT2 inhibitors. It works in a similar way. And this is a medication that was approved by the FDA based on the results of 2 studies, the Connect HD and the Connect HD2 studies. The Connect HD study was a 12-week study that evaluated the safety and efficacy of valbenazine in individuals with Huntington's-related chorea versus placebo for 12 weeks. And in fact, we did demonstrate that the trial was positive, that individuals that took valbenazine had a 3 times greater improvement in their chorea versus those who took placebo, based on the total maximal chorea score. And so valbenazine works to suppress chorea by actually indirectly decreasing the release of dopamine, which is an important neurotransmitter in the brain that modulates movement. I do want to mention, while we're excited about the recent FDA approval and the positive results of the Connect HD2 study and the Connect HD study, I'd like to acknowledge that all medications have potential side effects. And in this case, we need to mention that valbenazine did demonstrate some side effects: sleepiness, difficulty falling asleep, itchiness, and rash. And even more importantly, I'd like to mention the boxed warning that surrounds valbenazine and the other 2 VMAT2 inhibitors that are approved. And this box warning mentions that individuals have an increased risk of heightened depression and suicidal behavior and actions. And so I think we need to mention that in Huntington's disease, depression and suicidality are far more common than in the general population. And so this is a discussion that we must have with our patients and their care providers in order to ensure that everyone is well informed about the psychiatric symptoms that are not uncommon in HD.
Yes. Oh my goodness. And if you've ever known someone with HD, just the idea that there could be some kind of treatment for that involuntary movement, that chorea aspect, is just, it's unbelievable. So again, so happy to have you on today. So Katie, what does this approval mean for the Huntington's community?
So first, I would like to thank Neurocrine Biosciences for having us both on, giving the opportunity to talk to you today. So not only am I'm president of Help for HD International, which is a nonprofit that serves the Huntington's disease community, but I'm also a family member. So my husband was diagnosed with Huntington's disease at 24 years old, and he passed away at 41, and I have 3 children at risk. My husband's chorea was horrific. He never stopped moving. I actually asked him, if it bothered him, and he said, I just never stopped moving. So it impacted his swallowing, his walking, his severe weight loss, public impact, right? Encounters with law enforcement. So much of this symptom impacted me and my children and his life. So I wish there was more medication options for him, but I'm so glad that there is a new option available for my HD community.
Well, you are doing him such an honor by continuing to advocate and fight, Katie, and for your children as well. So I know you've got another interview, I believe, right now. So really fast, where can people learn more information?
So to learn more about valbenazine or Ingrezza, individuals can go to ingrezza.com. There are also amazing advocacy organizations underway to support our patients and families living with or at risk for HD. So Katie, I'll defer to you to mention those organizations.
Thank you so much.
So you can find, go ahead, sorry.
You go ahead, thank you.
No, I was just saying, if you would like to find us, we are at www.helpforhd.org, which is Help for HD International, and we would love to support you through your journey. We have so many resources. Please find us, and there's great organizations out there like HDSA, HDYO, HD Reach, and different organizations to help you along your journey. So reach out to us.
Oh, thank you again, both of you, so much. I will let you go. I know, like I said, you're on your way to the next interview, so thank you for getting this information out there. And you know, whether or not you have someone with Huntington's in your family or not, or at risk for that, that is such an amazing impact that they're making right now, something that they can really make a difference in people's lives. If you've, again, never heard anything about it, take a chance to, or take a moment to look that up, Huntington's Chorea and all of the organizations that they mentioned. So thank you again, and I'm your host, Jessie Ahmet from Valley News Now.
Thank you.
Yeah.